I'm a general dentist. For the past 18 professional years, I'm very fortunate to have attended to many patients of all ages, from a 4-day-old baby to a 90-year-old lady. All my patients are my teachers. And by managing their problems, I have discovered and learned that the tongue is a very important part, a very important organ of the body, but also very underrated as well. Listen to this. Someone is snoring. Baby is snoring. Aren't we all supposed to be born perfect? But babies do snore. And why do babies snore? I'll tell you in a minute. Baby come to me because of referral by lactation consultant, pediatrician, even chiropractors and osteopath. I see the babies because of 3 main reasons that they are encountering. They have suckling issue, swallowing issues, and feeding issues, and breathing issues as well. So, baby Alice came to me having all these 3. When she is breastfeeding, she has a problem of getting into a deep latch. When she feeds, she has clicking sounds, and she has a hard time forming a seal around the mouth, and that drops the suction. So every time when she needs to feed, she has to repump, and she sucks in a lot of air, and that gets some colic issue as well. She'll try, because innately she knows she has to feed, or else she will die. So all that effort, and many times later, she feels very tired, and she falls asleep on her job. The whole feeding time is extended. Of course, mommy feels the pain as well. There's a lot of gumming at the nipple, and sometimes there's mastitis, and that's really painful too. When it comes to swallowing, the baby has some issue too. She can't deliver the milk smoothly down her throat. She suffers regurgitation or reflux. Sometimes we're just vomiting all the milk that she just drank, and they don't gain weight. She drools a lot, and the saliva comes out from the side. And when it comes to breathing, wow, you can hear that. She doesn't like to be on her back, and she will try to stick her tongue out in order to breathe. Really tough. She likes to be carried, and her favorite position is over the shoulder. Sometimes she'll wake up, startled and crying, because she just couldn't breathe suddenly when she was sleeping. If all these issues are not corrected, we grow up, and as a toddler, some of them might suffer the continuation of this issue, for example, in swallowing. They can't swallow chunky food and they become messy eater. So, as a toddler, that's my son in the audience as well. Yeah, of course he's older now. He also has this issue of swallowing with his tongue thrusting forward, tongue thrust, and against his teeth. He eats slowly. He's a mouth breather. He likes to breathe through his mouth, and he gets dry, and he likes to drink a lot of water just to get lubricated. At night, he sleeps with his mouth open. Sometimes he snores. Often he grinds. He doesn't like to sleep on his back as well, and he moves a lot when he sleeps, trying to find the best position to breathe. And his favorite position is the one with his butt jutting up. And in the morning, actually all the time he'll suffer nasal congestion. Particularly in the morning, he has a lot of mucus to clear. Yeah, he can finish up the whole tissue box. Again, he has other issue on top of this. He can't pronounce his S sound properly. So even though his name is Sean, he'll say, my name is Sean. Right? So there's a low tongue position that he will do. Again, if all this is not settled, they'll grow up and into young adults. So I do see this girl coming to me, she's 11, preteen. She suffers from burning palm sensation, headaches and stomach ache all the time. And if you look at her posture like this, she's always having her head forward, opening her mouth, again trying to breathe. A compensation. She has difficulty in swallowing too, right? And that could be lead to her stomach issue. With the head always forward, we're suspending a 12-pound bowling ball off the axis. When it's right on top, 12. Forward, it gets heavier from 32 pounds to even 42 pounds as you get further forward. That's a lot of weight to carry. So, again, for her burning palm sensation, sometimes when she writes, she'll drop a pen. And the teacher will actually say, "What's wrong?" She'll cry, and mom has to sometimes even bring her out of school to see the doctor. But by the time she gets to the doctor, they can't discover any problem with her hand. Then where's the source? Often when she's having a headache and a stomach ache, again, she will draw back from the class. Mother is very worried about medical condition, but she's also very worried about her friends, her teacher, not trusting her because she's always like that. What's wrong? Again, growing up with this problem, if it's not resolved, what will happen? Ta-da! You're seeing one. Me, my own story. I grew up not being able to breastfeed. My mom blamed it on the liver soup that she just drank, right? And then she has no more milk. I grind my teeth a lot. In class or in school, my friends refuse to share the tent when we go for the camping together. I make a lot of noise. And even my army mates once was looking out for a rat in the army bunk, and they found me grinding on my bed. Right? And at 31 years old, I developed jaw joint pain, neck ache, hip pain. Sometimes I need even furniture to get me out of a low position. I can't do my R sound then, right? A lot of issues. And in my search for a solution, I found that the common denominator for all these cases is the tongue. Wow. Now, think about this. When you listen to me all this while, where is your tongue? Is it at the low position, middle, or high against the roof of your mouth, touching the top of your mouth on the palate? Take a swallow. When you swallow, is your tongue bracing against the roof of the mouth, or is it pushing against your teeth and going to the side also? Look at this dynamic MRI. That's the tongue. It's not the surfboard that we know. Yeah? It's the size of your fist fitted into the whole mouth, occupying the whole space. When it's right up, it opens your airway. Very important. To allow you to breathe well. When it's right up there, it helps you to swallow well. When it's high up there, even help you to support your head and neck well. Among many other things that we're going to discuss in another time. But this is important. And now the question is, when do we develop this? Only when we grow older? No. When we are baby, we need to suck, swallow, and breathe. Suckling reflex, swallowing reflex, breathing reflex. All this need tongue up. The tongue has to be up in order for all this to perform properly. That's why you can understand why baby Alice suffer all those consequences. Our brain, just now you saw that, has neuroplasticity. But in the very beginning of our life, we can't make decision for ourselves, we can't do it. So we have innate processes to help us to survive. So 12 cranial nerves help us. When we feel the nipple, we turn our neck, firing the spinal accessory to turn towards it. And then our facial nerve, trigeminal nerve, help us to open our mouth and facial latch over. Then your tongue and your floor of the mouth do the aloha dance to move the milk and deliver it to the throat. Then your vagus nerve has to control between your swallowing and your breathing and move the peristaltic movement down, right, coordinating the gut movement. Then you can smell your mummy, olfactory nerve, right? Your trochlear, abducens, your optic nerve help you to figure out a bit of that areola. And if you're given a chance to be on the tummy, you can even crawl your way to the breast to feed with your vestibular ocular nerve. So all 12 nerves are involved right at the beginning of your life. All these resources are given to you to help you to do one thing only, feed. And what is feeding for? Is that early onset of your myofunctional training of your tongue so that you can do many things better when you grow up. So if everything is done well, the tongue lifts up, it develops your jaws well too, allowing enough space for the teeth to erupt, and that continues on. Your adult teeth have also more space as your tongue develops, and you develop the more space to actually erupt, and there won't be crowding and misalignment. If you can put your tongue up to swallow well, it's very helpful. But most importantly, it will help you to breathe well. How important is breathing to us? Very. Every breath that we take is important. You can don't eat and don't drink for days and weeks, but how long can you not breathe? But ask yourself, how much resources have you put into food and drinks, and how much have you put into air and breathing just last week alone? Very importantly, baby Alice. What she's suffering from is a tongue tie that restricts her tongue from moving up. A study from Stanford University, led by Professor Christian Guilleminault, has already proven that a restricted tongue, because of the frenum, can cause obstructive sleep apnea in children. And of course, if that is not resolved, it will become a problem for all of us as adults too. And if we are able to sleep better, like some of this issue that was highlighted earlier in some of the children, that they're having ADHD, could be a sign that they're just not having enough rest. So, in order for us to make sure we grow up healthy, there are few things that we need to look into. Tongue up, lip closed, and breathe through nose. This is the picture of health that we want to achieve. So when the tongue is up, it allows for good baby feeding. And if we continue to develop that, we'll have good arches, right? We grow up breathing only through our nose, not our mouth. We'll be able to stand upright, aligning not only just teeth, but the whole body. And it will have this whole effect from baby all the way to elderly. In Japan, they're also having exercises to help out with old people, to help them to swallow better, because the tongue strength is dropping as they age. So, practice this. Tongue up, lip closed, and breathe through nose, and you'll be healthy. Thank you.